put, put name to face. So I will quickly start out. I'm Melinda Stolle. I currently chair the Wisconsin Cancer Collaborative. I am the Associate Director of Cancer Prevention and Control at the Medical College of Wisconsin. I'm also a professor, and I do research in cancer survivorship and disparities. Beth, you want to take it over?
Yep, I will. Sorry, I'm just trying to quickly admit people into the meeting.
Oh, I'm sorry. Okay, I thought maybe I did something wrong.
No, not at all. This was all on me. So I will quickly advance the slides. So just real quick rundown of the day. And I know we had sent the agenda. So we're going to just walk through the policy committee updates. We're going to do the Wisconsin Action Plan, kind of the continuation of our discussion from last year. Talk about a diversity inclusion assessment, early preliminary plans on our summit for this year, and then any updates and closings for this year or for this meeting. So we first wanted to make sure we just welcomed our new members. So hopefully those that have been on the steering committee can see that we have some new faces that have joined us today. So just because we have so many new faces and new individuals, we were hoping that we could just go around and do introductions today. So real basic name, organizations, either that you're employed with or ones even including ones you may work with in a non-professional capacity, and then just what is your role in those organizations. And then just to get to know everybody, we thought we'd do one fun thing of like, what is something you're hopeful for in 2021? It could be you might feel like you can take a vacation, you're going to hug somebody, you want to go to a sporting event, or maybe you're just so sick of winter and you are just looking forward to summer where you can sit outside and barbecue or sit around the campfire. So I just, because we're a big team here, I'm just going to walk through and go through my screen and call on people. We'll start with just our committee members, but I also have the staff team on the line today, so I want to make sure they get a chance to introduce themselves. So first, if Dr. Edel, if you wouldn't mind starting us off.
Yes, there you go. Now I'm on mute. Can everybody hear me? Okay. Yeah, so I'm Kurt Edel. I'm a medical oncologist. I am at Gundersen, where I am currently the Cancer Center Director. I've been at Gundersen since 2001. And in my life before coming here, I think I spent an eternity at UW. I think the thing that I'm really looking forward to is I'd really love to see the Badger Gopher game, which is traditionally one of the last games of the season. And I'm feeling that by that time, I should probably be able to sit in the stands and cheer on the Badgers.
I love it, Dr. Edel. I hope to be there too. So, Annika.
Hello, everyone. My name is Annika Swenson. I work with Novartis Pharmaceuticals. I lead the MSL, Medical Science Liaison Group for Solid Tumor Oncology. I hail from the Northwoods of Hayward, Wisconsin, and I currently live out in rural southwestern Wisconsin outside of Mineral Point. And I am looking forward to hugging my 1-year-old nephew who I haven't gotten to hug, and my soon to be born nephew in 2021.
Thank you, Annika. Dr. Walker, would you mind introducing yourself?
Hi, I'm Alonzo Walker, retired professor of surgical oncology at the Medical College of Wisconsin. It'll be 1 year, 1 year is January. What I'm looking forward to is a real vacation. I need to get away to have a hopefully successful retirement. So I'm looking forward to that. Someplace in the Caribbean.
I love it. That's a great plan for this year. I wish we could all go. Laura, would you mind?
Yeah, good afternoon, everyone. My name is Laura Pedersen. I'm the Executive Director with Scenic Rivers Area Health Education Center, one of 7 AHEC centers across the state. And we have a state program office at the UW School of Medicine and Public Health. My office is near Cashton, Wisconsin, but most days you can find me here, which is my home, and I'm in Buffalo City, Wisconsin, which is just north of La Crosse. Something that I am hopeful for in 2021, maybe something that some of you are doing now. I'm just not in a place where I'm comfortable with it yet, which is going out to eat at a restaurant and just sitting back and having a nice beverage and a delicious meal and enjoying the ambiance of somewhere other than my own kitchen. So I'm glad to meet everyone and happy to be with you. Thanks.
Thank you so much, Laura. Yeah, I was talking with a friend yesterday, just not only going out to eat, but having somebody else clean up for you. I think we're looking forward to that experience where you can just leave the dishes on the table and walk away. So thank you. Regina, would you mind sharing?
Hello, I'm Regina Vitiver, and I'm the Section Chief for Chronic Disease Prevention and Cancer Control with the Wisconsin Division of Public Health. And my father-in-law has already received his second dose, and my mother and mother-in-law are getting their second doses this week. So I am really looking forward to seeing our parents again.
Yeah, thank you. That is so what we need in 2021 is to see those loved ones. Thank you. Dr. Garbowski, would you mind introducing yourself?
Hi, I'm Carol Grabowski. I'm a radiation oncologist with the Marshfield Clinic, and presently I work in Stevens Point at the Marshfield Clinic Cancer Center. I'm also boarded in hospice and palliative care, so I've done inpatient palliative medicine, been a hospice medical director, and done lots of home visits. My husband and I were supposed to be in Bologna for the entire month of November in 2020, so I'm really looking forward to going to Italy again soon, and I kind of want to hug everybody.
I do have a friend that said, just be prepared. I'm going to hug absolutely
Oh,
everybody
God,
I
I've
see
told
when
them.
it's done. So just be prepared. The hugs
Exactly.
are
Everybody.
right. Thank you. Paula, would you mind going next?
Certainly, and I found the unmute button. Usually that's my MO is I'm waiting, or people are waiting for me to talk because I haven't unmuted. So nice to hear all of you and see your pictures. I'm Paula Silla. I am the Health Education Manager at the La Crosse County Health Department. I have been in the health education field for a long time. I started with the department in 1989, and so it's been a long time. I've been the manager of the health education section for 6 years, and have been involved in COVID response since last February. Now I spend about a fourth of my time in COVID response and 3/4 of my time managing the health education staff and whatever else needs to be done from my my management role. Personally, my husband has his 4th anniversary of receiving a stem cell transplant for myelofibrosis at UW-Madison on Sunday. And so we are going to have a very small celebration with our 2 sons and a girlfriend and our grand dog. But what I'm looking forward to in 2022, I hope, is to have what we call a celebration. A couple years ago when Ken was at 2 years, we had a big yard party picnic with music, and I'm looking forward to doing that again. We had friends and relatives come. Everybody brought a dish to pass and their own, beverage. We had soda and water and some beer for legal people. But I'm looking forward to that again, where we can gather folks together. We live out in the country about 12 miles outside of La Crosse, and have a big yard. And our hay barn is like a shelter house where we set up tables, and I'm just looking forward to that. Probably not until 2022, but I'm really looking forward to that. So that's a little bit about me.
Thanks, Paula. Let's see, Nancy.
Hi, I'm Nancy Sunleitner, and I am the Education and Training Coordinator for the Wisconsin Cancer Reporting System. And what that really entails on a normal year would be really working with our cancer reporters so that they get their cancer cases reported to us and are following the required data elements. And just like everybody else, I think I am really, really looking forward to that vacation. Numerous years we have traveled with different family members, my 3 adult children, 2 of them with wives now, normally we have gone to different areas in Mexico. So, I'm really looking forward to at some point being able to do that again. That's it about me.
Great. Thank you, Nancy. Linnea, would you mind going next?
Sure. So I'm Linnea Stenz. I'm the Executive Director, CEO of Gilda's Club Madison. We provide emotional support, cancer education, and wellness opportunities at no cost to families that are dealing with cancer. We're located in Dane County, but we are currently serving a larger group of folks across Wisconsin because all of our programs are still virtual and probably will be through at least the end of the summer. I am personally looking forward to hopefully meeting my first great niece, who was born, unfortunately, right before COVID hit. So looking forward to hopefully being able to visit my family in California and get to meet her hopefully before her second birthday, something like that. Thanks.
Great. Thank you so much. Andrea, are you on the line? Were you able to join?
Can you hear me okay?
I can.
Okay, I'm in a shared office space today, so a little different. I'm Andrea Larson, and I work at Westfields Hospital out in Richmond, Wisconsin. I'm their oncology nurse navigator. I've been doing that for several years, and previous to that, I've been in oncology for almost 20 years doing chemo and cancer research. So I'm excited to be a new member of the steering committee this year. And I'm looking forward to seeing my sister and 3 nieces down in Georgia. I haven't seen them now for over a year, so hopefully soon.
Great. Thank you so much. Angela.
Hi, everyone. I'm Angela Wariakton, and I am the unit supervisor over the Wisconsin Cancer Reporting System, and it's housed within the Division of Public Health. The thing that I'm hopeful for, aside from all the wonderful things that you guys have already said, is the return of racing. So I'm really hopeful this summer that maybe I can do my second marathon. My first one was done all by myself last year on a very quiet trail. And so it'd be nice to have a group and some spectators and all those exciting things that go along with racing. Thanks.
Thank you, Angela. Crystal.
Hello, everyone. My name is Crystal Landeros. I'm the Bilingual Tobacco Prevention Coordinator with the Hispanic Tobacco Prevention Network of Wisconsin. Been in my role for a little over a year. I'm very excited to be here. It's a pleasure. And really for 2021, I'm looking forward to a little more normalcy, to some sunshine, good weather, and for graduating with my MPH.
That's awesome. Thank you, Crystal. Jen.
Hi, everyone. Can you hear me okay? Sometimes okay. I'm Jen Collins, the UW Carbone Cancer Center in the Clinical Trials Research Office. I've been there about 12 years doing kind of a variety of things. I currently manage a few groups that do genomically driven clinical trials, including the Precision Medicine Molecular Tumor Board. And outside of my work at the Cancer Center, I am a birth and a childbirth educator as well.
Thank you, Jen.
And what am I looking forward to? I feel okay saying this because I think if you asked my in-laws what they were looking forward to, being able to drop my 6-year-old off with my mother and father-in-law and going somewhere with my husband, or even just sitting in a quiet house.
Thanks, Jen. And I know your mother and father-in-law, and I would agree, they really do want to see your 6-year-old.
Just say the word. Their first dose, they were both scheduled to get their first dose at the beginning of February and it got pushed back. So now we're just.
Well, fingers crossed for them.
Yeah.
Kim.
Oh, yep. Hi, everyone. I am Kim Kenner with the American Cancer Society. I'm the Senior Director for Cancer Control Strategic Partnerships. I sit in Green Bay. I noticed I have a screen right now of a fake background. That is not my background. I'm in my home office. But what am I looking forward to or hopeful for in 2021? I would say is good health for my family. We've had a lot of, unfortunately, health issues, but we are moving in a really great direction. And so I'm looking for a healthier 2021. And then also family gatherings that we haven't had a chance to have. So thank you.
Thanks, Kim. Gail, I believe you're on by phone, right?
Good afternoon. Yes, I am. Good afternoon, everyone. This is Gail Johnson. I am the director of the Wisconsin Well Woman Program. And one of the reasons that I'm not on screen is because I have a couple of deliverables that I have to get out the door. So I'm working on some other things as well as participating in the meeting. I am looking forward to traveling again. I hope that I get to go somewhere by the end of this year. But more importantly, I'm really looking forward to a family gathering. I have 5 siblings and I have a ton of nieces and nephews, and I would just love to see all of them again, safely, of course.
Thanks, Gail. And thanks for joining us today. I know you were busy, so I'm glad you could jump on. One last one I know we have is Sandy, who is traveling. So I don't know if you're able to jump on, Sandy. Okay, we may come back to Sandy then. I know she was traveling and going to jump on. So one of our steering committee members that also plays a role with our staff team is Noelle. So Noelle, would you mind jumping on?
Yep. Hi, everybody. My name is Noelle Conti. I am a medical oncologist at UW Health in GI tumors, and I'm also an associate professor at the University of Wisconsin, and I'm the PI for the program. My interests are in clinical trials, new drugs for GI cancers, and then cancer control. And the thing I'm looking forward to in 2021 is taking my 3 kids and my husband to a Cubs game, probably with Jen Collins and Amy Johnson. Go Cubs.
That's awesome. I hope it happens. I hope you can all go. That would be amazing. So, you know, the other piece to our steering committee is our Wisconsin Cancer Collaborative staff team. And they're all on the phone today. So I'd love if we could just walk through and make sure they can all do introductions and you get that team too. So Sarah, would you want to start?
Yes. Hi, everyone. Thanks for joining today. I'm Sarah Kirch, and I am the program director for the Wisconsin Cancer Collaborative. So I kind of serve as a liaison between the staff and the CDC and make sure that we're getting all of our things accomplished. I have unique privilege in really supervising this wonderful team. Things I'm looking forward to, just literally in the last 5 minutes, I found out that my mother-in-law had got scheduled for her first COVID vaccine. So I, like Jen, am really excited to drive to Chicago and leave my 2- and 4-year-old there and have them have a really great time without me. So, yeah.
Thanks, Sarah. Amy.
I'm Amy Johnson. I'm a policy coordinator for the collaborative. My summer plans just changed. I'm going to a Cubs game. That's what I'm looking forward to.
Oh, that's awesome. Thanks, Amy. Oh, Sandy, you're on. Would you
I
mind
am.
saying hi and introducing
Hi.
yourself?
Sure. I just walked through the door. So I was watching my 1-month-old grandbaby because my youngest had to have a 1-day surgery. But I'm Sandy Bernier. I work with the Fond du Lac County Health Department. I'm the program manager for a multi-jurisdictional coalition, which covers Green Lake, Waushara, Marquette, Fond du Lac, of course, tobacco prevention and control. So happy to be here.
Thanks, Sandy. On our staff team, Allison, would you mind jumping on?
Hi, everybody. I'm Allison Antoine. I am one of the staff members that's based in the Milwaukee area. Normally, my office is at the Center for Urban Population Health in the Aurora Sinai Hospital in downtown, but I'm currently in Port Washington. I am also the current chair of the National Association of Chronic Disease Directors Cancer Council, which is kind of the national version of it's pretty much just a national version of our local coalition, but it represents all of the CDC funded cancer programs, so breast and cervical, comprehensive cancer control, colorectal, and registries. And it's really great to be able to participate on that level and to also be able to when the time is right, to be able to brag about the good work that is happening in Wisconsin to our peers across the country and beyond, since we do also involve CDC grantees that are in the Pacific Islands and Puerto Rico, the Virgin Islands, etc. So I would love to go to any of those places in 2021 on some type of a site visit. It hasn't happened yet, but I'm remaining hopeful. My passport is ready to go. My bag is almost packed as well. So looking forward to travel.
Thanks, Allison. Alex.
Hi, everybody. My name is Alex Peters, and I am an outreach specialist with the Wisconsin Cancer Collaborative. And my work focuses on areas of cancer risk reduction. So I work on a lot of different areas, but the main one right now is alcohol. One thing that I'm really hopeful for in 2021 is getting to hug my grandparents again. So that is something I'm really hopeful that I will be able to do. My one set of grandparents is getting their second vaccine tomorrow, actually. So we're getting a little bit closer.
That's great, Alex. Thank you. Alexandria.
Hi, everybody. I'm Alexandria Colweatherer, and I'm an outreach specialist with the Collaborative. I focus on cancer prevention vaccines, so HPV and hepatitis B, and then cancer survivorship. I think the biggest thing I'm looking forward to in 2021 is having a family holiday that isn't Zoom. I am the oldest of 6 kids and have a big family, and I've really, really missed all of them and seeing them in person. So hopefully getting closer to that.
Thanks, Alexandria. And Alexandria just had, which we'll share through our communication channels, but you just had an article published, right, in the Wisconsin Medical Journal this week on HPV vaccination rates.
Yes, excited to share with everybody.
Yeah, so we're excited. We'll get that out and make sure everybody can see it. But great job. Thanks, Alexandria. Mary.
Hello, everyone. My name is Mary. I'm an outreach specialist with the Cancer Collaborative. My area is screening as well as evaluation and some data visualization. One thing I am looking forward to in 2021, well, it's not one thing, but after the great weather we had yesterday, I'm really looking forward to some warmer weather. So
thanks, Mary. Yep. And Tina.
Hi, everyone. I am the member engagement specialist for the Wisconsin Cancer Collaborative. One thing that I am looking forward to in 2021 would probably be a vacation. I'm definitely ready to get out of Wisconsin and go somewhere tropical or even, to a national park somewhere. So that's definitely on my list.
Great. Thank you, Tina. Did I miss anybody, or is there anyone that didn't get a chance to introduce themselves? Wonderful. Thank you. Dr. Stahli, I'll turn it back over to you for the next piece.
Okay, so we will now move to a policy update, and Amy and Kurt, if you can take us through that, that would be great.
Hey, great. Beth, you want to advance the slide? And we welcome Dr. Edel. He'll be kicking off the new year of policy committee meetings, which will happen next year.
Yeah.
And my cat just decided to jump up. Here we go.
I just want to interject. I thank everybody for giving me this opportunity. I'm going to try to do everything I can to make this as successful as possible. So I just want to thank everybody for putting faith in me. Thank you.
Great. Okay, we're going to start with the 2021-2022 policy agenda, and then I'll do a budget legislative update after that. So every 2 years, the collaborative develops a policy agenda, and the agenda comes directly from the cancer plan, from the chapters of the cancer plan. The agenda serves as an educational document that helps our members make the connection between policy and cancer prevention and control. And from there, our members are able to communicate with their governmental leaders on all levels about the need for policy change. The agenda must be approved by the policy committee and by the steering committee. The policy committee, for those of you who are new, is comprised of issue experts and state lobbyists and oncologists whose expertise is understanding health policy, including cancer policy, and knowing how government works and just what's realistic. The process to develop the policy agenda began last autumn. We had a meeting with the members of the policy committee and did some polling, and they were able to give their opinions on what was important, what was realistic. We drafted the agenda and then presented it to the policy committee in December, and we had a robust discussion in the meeting itself, and they approved the agenda that we presented to them without any changes. So let's dive in. So goal number one, and I think what I'd like to do, if okay with you, Dr. Sully, is go through the agenda and then have time for questions after that. Goal number one, this comes from chapter 1 of the plan on health equity, highlights the need for increasing access to the Medicaid program, eliminating insurance loopholes that limit ability to receive necessary prevention and control services, and ensuring protections for pre-existing conditions and lifetime limits on health insurance coverage. Goal number 2 comes from chapter number 2, risk reduction. This is specifically addresses tobacco policy. It directs the attention to the need for increasing taxes on cigarettes and consistently taxing tobacco products. Also restricting youth access to cigarettes and other tobacco products and e-cigarettes. And finally, strengthening clean air policies to include e-cigarettes. Okay, next slide, please. Goal 3 comes also from chapter 2, risk reduction. Third goal is increasing access to cancer prevention vaccine services. This includes hepatitis B and the HPV vaccine. The agenda highlights the need for insurance coverage for the vaccine. It also supports funding for the federal Vaccines for Children program. The state receives funding, but the state does not add its own funding to that. So it receives funding from the federal government because this is a state and federal document. And coordinating vaccines for baby and mother in the WIC program. Goal 4 comes from chapter 3, early detection and screening. The first goal is reduce barriers to cancer screening and increase insurance coverage for diagnostic services. The first bullet, keep decision makers informed on current recommendations for cancer screenings. That may be the first thing that we tackle. You may have heard that USPSTF is recommending that the age for recommended colonoscopies drop from 50 years to 45 years. If this is adopted, we'll be in communication with partners from the policy committee and speak with the Office of the Commissioner of Insurance to make sure he's aware of it. As for full insurance coverage, for the second bullet, for diagnostic testing, this was partially addressed in the COVID appropriations bill that was passed late last year, where they phased out the colonoscopies Medicare coverage. through to 2030, so you don't have the problem of a surprise medical bill if your result is diagnostic as opposed to screening. I think I got that right, Allison. This remains a problem also in other insurance coverage because it's those who do not follow the Affordable Care Act requirements do not necessarily cover screening procedures. Finally, establish a state registry that tracks cancer screening completion. Moving on to goal 5. This comes from chapter 4, treatment. And the 5th goal is reduce cancer costs incurred by patients and families. First, educate policymakers on the impact of financial stress of cancer care. We know that cancer is a major financial burden, and we will be releasing our financial toxicity issue brief and providing that to legislators in March. And that will be part of a legislative drop of materials that we will be distributing. Also, from a policy perspective, looking at increased insurance, reduce out-of-pocket costs supporting cancer treatment and associated expenses. That's done typically incrementally. So you're not going to see like one main bill addressing that. But, like on the oral chemo bill that insurers could not charge you more for oral chemo as opposed to intravenous. Okay, goal 6. This is the final goal. Chapter 6, end of life. This goal is to ensure access to quality palliative care. It calls for establishment of palliative care advisory council in the state. This has been introduced in previous sessions, and we expect that it will be introduced again. And increase insurance coverage for palliative care conversation with medical professionals and associated services. This is covered kind of inconsistently among health plans. So your review now is important. Your review is always important, but now is the step for you to review this and ask any questions. If you approve it, then we send it on to our membership and inform them, and then continue throughout the next 2 years on making that connection between legislation and policy on all levels and how it relates to cancer control and prevention into patients. Okay, any questions?
Amy, a quick question for you. And more technical is, when is the legislation drop date, where you go around and drop materials off at the legislator's office? And how, given where we're at right now with COVID, do you run into any legislators at that point in time, or is that just like just a mail drop that you do at each office?
Yeah, the date is targeted for mid-March. I don't have a specific date. That's when we will be sending out a mailing. The building is kind of limited in access, so we will not be doing the physical walk around and delivery. So we'll be doing the mailing and then also send by email, which reminds me, if any of you are interested in sending, it would be a copy of a letter from Sarah, the financial toxicity issue brief, Cancer County profiles, and the cancer plan. If any of you are interested in sending that to your elected officials on the state level, please let me know and I can give you those materials. And probably for most of you, you'd be sending it as an individual constituent, not from your professional role.
So Amy, for the benefit, and I guess Sarah and Beth as well, of the new members, is there anything in particular that, besides emailing legislators and things like that, that we can sort of orient people on the role on how we can contribute to your work and,
So this will be part of the process of educating when bills come up or when certain policies come up. It's a matter of educating and communicating that to members of the steering committee and then of the general membership and partners, and making that connection for them. We can't engage in grassroots advocacy. So we can't ever say, call on your members to do X, Y, and Z. We can't engage in direct advocacy, with legislators, but we can educate, inform, and nicely encourage. Any more questions?
No, but it looks like it's a lot to do.
Yes.
Ambitious.
So I have a question, Amy.
Yes.
This is Paula. I am just curious, of the 5 or the 6 goals, how many of them will require a bill to be introduced in the legislature? Are some of them, they don't include that political back and forth process?
So if I understand correctly, like, Palliative Care Advisory Council, that would be a bill.
Oh, good, okay. That's kind of what I'm looking for, clarification. Okay.
Yeah. And I would say, we have the tobacco provisions, which I'm going to talk about in my budget section of my presentation. And then any attempts to address cancer costs to patients and so forth.
And insurance coverage and
Insurance
Medicare and all
coverage.
of that has to go through the legislative process. Okay.
Yes. Yes.
Thank you.
Any more questions?
Yeah.
I would maybe just add a comment to add to Dr. Stahli's question about, what do we do with this massive document? It's being ambitious. I think oftentimes the organizations we all sit at have government relations officials. And so I think a really great step that all of us could take is making sure that those folks know that you're part of this group and that this is the policy agenda, because oftentimes they're looking for, various ideas. And if we can all align together on some of these common goals, we'll get there a little faster. So I would recommend and suggest maybe taking some time to do that if you have an individual in that role.
That's great, Sarah. Thank you for that. Any other comments, questions?
So I have one other comment or question. This is Paula Silla again. So I was thinking about in public health, we have Wisconsin Health Education Network, which is lots of frontline health educators, but then there's the Wisconsin Public Health Association as well. Do you see that sharing this policy agenda is something that we should do as individuals who are members of those groups, or would it be something that would be more official coming from the Wisconsin Cancer Collaborative?
I think definitely in your role would be good to share. And I imagine, Sarah, this has been done, that sort of approach has been done in the past too. We would, it's something that we speak to. So the staff relationships with those groups too, we would share that material. But definitely as a member of the steering committee, as a member of the collaborative, if you want to share that, that would be helpful.
Okay, thank you.
And we do have a representative from the Public Affairs Committee from WPHA, Wisconsin Public Health Association, a representative on the policy committee. So there's kind of an inside line, but obviously as members of those associations or other associations, that you might just be affiliated with and not actually employed, that's another audience that you could present this in, surely. So thanks for bringing that up, Paula.
This is Sandy. I don't have a question, but a comment. Those of us working in tobacco prevention and control have had our meetings with our state legislators to educate them. So they've gotten a lot of information on disparities in tobacco, how the program's funded, that kind of thing. And there's always constituents that are included in those meetings. So we had to have those all done before the governor put his budget out. So they have been getting a lot of information. So that's good for tobacco prevention.
Great. You're foreshadowing the next few slides.
Yes. Should I dive in?
Yes, I think you have our blessing, right?
Okay.
I'm hearing the committee. I think it sounds like we are in agreement with the policy agenda and the great work of the policy committee. So thank you, Amy, for sharing, and all the hard work of the committee for pulling this together.
Thank you. And thank you for taking the time to review this and ask questions and being engaged. Okay, let's go to the next slide. The budget. Last week, Governor Evers released his $91 billion biennial budget blueprint, which is really the first step in the budget process. I'm going to highlight this list, but this is just a snippet of everything that's included in the budget. So I tried to take what is our lens of cancer, what is something that things that might be interesting to us. So first of all, he does propose to expand Medicaid coverage to childless adults with incomes up to 138% of poverty level. This could apply to about 90,000 people, half of whom would be newly eligible to Medicaid. It would generate about $634 million in savings, but the governor reinvests that in a number of ways. It would increase payments and compensation to hospitals with high percentage of Medicaid patients. Would transition away from the federal Affordable Care Act insurance marketplace and create a new state marketplace. Develops a plan to offer premium assistance to individuals between 138% of federal poverty level and 250% who are also enrolled in a silver plan. It would create a public option insurance plan by 2025, or if our friends in SCOTUS decide that the Affordable Care Act is not severable and strike it down. So it could be next year, but this would be something that I think we're the only state that would be moving forward on it, or one of few. The budget would also prohibit health insurance insurers from establishing annual or lifetime limits on health insurance plans, and would require all plans to cover essential health benefits that are covered under ACA. Increase funding for the Well Woman program and maintains funding for cancer control and prevention, and increases funding for free and charitable clinics and centers and community health centers. Both would receive an additional $4 million over 2 years. So in addition to that, there was governor task forces, one on prescription drugs and another one on caregivers. Just a few highlights that were pulled from their recommendations: eliminating Badger Care prescription drug copays, create a patient pharmacy benefit tool to help prescribers weigh out-of-pocket costs when choosing between similar medications, and drug reimportation from countries with less expensive costs. For the caregiver task force, a up to $500 tax credit on caregiving expenses. It's based on your income. Create a tailored caregiver assessment and referral program to support family caregivers, and allow an expansion of the Family Medical Leave Act to include grandparents, siblings, and grandchildren. Okay, next slide. This year, the Department of Revenue portions were almost as exciting as Department of Health Services programs. There's a lot of tobacco provisions in this, so we're just going to focus on what was tobacco provisions in DHS and what was tobacco provisions in Department of Revenue. In DHS, the governor recommends increasing the purchase age for tobacco products, cigarettes, and vapor products to 21 years. This puts us in line with the federal law. Prohibit vapor use in indoor locations. So this updates the Clean Indoor Air Law. Prohibit vapor products on private, public, and charter school properties, and launch a $2 million campaign to prevent initiation of tobacco and vapor product use. In Department of Revenue, the governor calls for a vapor product tax on fluid and device. Tax would be 71% of manufacturer's list price. This is a huge jump from the current tax, which is 5 cents per milliliter on the fluid. So you think of a Juul pod tax is 3.5 cents. So this is quite a jump. You would also tax little cigars at the cigarette tax level. Implement municipal licensing of vapor product sellers. This is a huge gap that's existed. And allow restricted access to cigarettes and tobacco products so that only clerks and store employees could access products for customers. The next step now, governor's released it. It goes to the Joint Committee on Finance. It's comprised of members of the Assembly and the Senate. They've already signaled that they have concerns, so they will be doing their own draft. And then it will probably come out of that committee in early to mid-June, go to the full chambers for final approval, and then on to the governor's desk, where I'm sure he will have his veto pen fired up and ready to go. So that's the budget. And I mean, basically, budget is kind of the highlight of what's going on. We'll have more policy bills coming up in the next steering committee meeting.
Amy, this is Kurt. A quick question for you. Given those lofty goals, what do you think is going to be reasonable at the end of the day, or what do you see as coming out that of the last two slides that would probably stand the Assembly and Senate?
I think the things that have been controversial that the legislators have said no to would be marijuana legalization. They haven't really, nobody's gone on the record saying on vapor or taxing cigarettes. So there could be the increase on e-cigarettes, tobacco taxes, could do indoor clean air. I would imagine some of these other things could go, but it's kind of hard to say. We don't, the age might be increased. It's a little difficult to know. We haven't gotten any real signals, but as far as comparing the policy agenda to these budget provisions, there's got to be something, I would think, on tobacco that would go through.
Okay, and then how about on the insurance front, Medicaid expansion and markets? Is that getting traction, or how do you see that playing out?
Medicaid expansion probably is dead. It's hard to say what he will do with that, but that is not received favorably.
Yeah, I understand like the big Medicaid expansion, but just the sort of around the edges about allowing, what did you mention that would affect about 90,000 of?
Yeah, that's expansion.
Yeah, that expansion. Oh, so
Yeah.
even that expansion is probably not feasible. Is that what you're getting at?
Possibly, yeah.
Oh,
In all likelihood.
Dang. Dang.
But who knows about copays? He did work. He is basically saying no to work requirements. So we'll see what happens in some of these other issue areas.
Amy, this is Gail Johnson.
Yes.
Just a question about the marketplace, what we kind of now know as covering Wisconsin. So we're looking to, or the proposal is to move away from what we have now in terms of providing information and helping individuals and families enroll in some type of health coverage plan. So we're looking at developing something that's strictly a Wisconsin product. Is that what you're saying, or a Wisconsin entity?
It would be yes. A number of states have their own market exchanges. Instead of Fed. So it would be transitioning away from the Wisconsin's use of a federal exchange to creating a state exchange.
Would Wisconsin still be eligible for federal assistance? I know, when, 9-10 years ago, when all of this started, there was all kinds of federal assistance. So if Wisconsin moves away to its own system, are there federal dollars available for that?
I would imagine so. I haven't heard to the contrary.
Okay.
Would you like me to follow up and find out?
Yeah, that would be great. And then just one more question. What's the rationale? And I'm just inquiring, what's the rationale for Wisconsin moving to its own system? And as you said, I know that there are other states who from the very beginning decided we're going to had a system that reflects our state, and that was all well and good. So I'm just wondering what's the rationale? Am I reading more into this than there really is, or are there some things that maybe we don't understand, or is it just be a better product?
I think there's two things. First of all, there would be savings. We do have to pay the feds for this exchange, for the use of the exchange.
Okay.
But then
Okay.
also, we would be able to have flexibility with it. There was a delay in, there was one administration that is no longer in power right now was reluctant to open up the federal market, federal exchange during really the heart of the pandemic for people who were needing coverage. And the state would be able to open its own exchange. So allow people to enroll in period of times that they set.
Okay. And Amy, let me say thank you for this really great report. Thank you very much.
Thanks, Gail.
Yeah, thank you, Amy. And just if you didn't see the chat, you have Kim and Paula have both volunteered to help connect with their legislators. So what I can do too is when I share the notes from today's meeting, I will share Amy's email address. So if anybody would like to also be a part of that, reaching out to their legislators, or if they have any questions, if they thought like, wow, I was thinking about this piece that you shared and I'd love to hear a little bit more, I will include Amy's email address so that everybody can connect with her. Thanks, Amy.
Hey, Amy, what would be great also for those goals, because I'm thinking about our government relations person, is do you all have that like in a document that we could just share with our government relations people?
You mean the policy agenda?
Yeah, your policy agenda. Yeah.
Yes, we do. And are you thinking about Nathan Birkin?
Yeah.
He's on the policy committee.
Oh, he is. You're right.
Yep.
You're right. Never mind.
And he's a very engaged member, so
Yeah.
he knows what's going on.
Great. But thank you.
Mm-hmm.
And we do have that finalized document, so I'll send that out too. So in
I
case
think
there's,
that would be helpful for people to have. Yeah.
we'll get that out.
Great. Thank you. Anything else related to policy? It's kind of exciting. So we're now going to turn things over to Beth and Sarah, who are going to talk about how we're moving our action plan forward and our plans for a diversity and inclusion assessment. So Beth, this may go until I need to pop off. So if I'm not here, you know why.
I gotcha. Thanks, Melinda. So Sarah and I are going to tag team a little bit. So I'm going to start off starting with a review of action plans, because I know we've talked about them previously, but where are we at? What did we so far decide? So just a really quick review is back after we released our cancer plan last year in August, we came to our September meeting and we said, this plan is huge. We know we can't accomplish everything that's in it. And we would like to maybe narrow down the focus a little bit because we know not only do we as a collaborative limited resources, our members have limited resources, but is there opportunities for us to focus our efforts in specific areas to really accelerate progress? So in that meeting, we talked about what those areas could be. So after a meeting, we went to our membership. So we took our October webinar and said, here are the narrowing down of what could be in an action plan from our steering committee, and took it to the membership and said, could you help us narrow it down just a little bit more? So what are the priorities of what we would want to see in an action plan to have these accelerated efforts? And where we really feel the Wisconsin Cancer Collaborative in taking either a lead or an emphasized effort by our members could really see that progress move forward quicker. So these are the priorities that were selected after that. So we came down with health equity, risk reduction, specifically looking at healthy eating, physical activity, and alcohol consumption, cancer screening and treatment. Mostly when we talk treatment, it was access to quality treatment. So where we're at right now is that we would like to finalize this effort in the next couple of months by our action plans really having our determined focus of efforts in 2021, and 2022. So this will be just about a 2-year plan that we're looking at. What we've also talked about is that given the past year, we really feel that all these activities need to be aligned with a pandemic recovery effort. So anything a year ago that we may have planned in any of those 4 areas I mentioned might look really different than where they are today. So when we talk about, alcohol consumption, that's changed. For us being a kind of an alcohol consumption state, it's changed, unfortunately, for the worse, right, over the past year. And we know that, and we know that's part of the pandemic. And we have to take that into consideration, that people are in a different space. We're all, as a community, in a different place right now. So how do we really look at those efforts with that lens on our pandemic recovery? And what we really want to do is we want to figure out how we can create action steps in this plan that could engage our membership to take meaningful impact around these cancer objectives. So we don't want it just to be what can the collaborative do, but what can we do and how can we move forward efforts that would be meaningful to our membership to take on. So one of the areas that we really wanted to start with is our equity chapter. And we felt like in looking at health equity, one of the first things we might want to do as a collaborative is for us to begin to look at ourselves and really understand ourselves in order to realize what might make the biggest impact moving forward in our efforts. So I'm going to turn it over to Sarah to talk through really what we were thinking and get your ideas and feedback on kind of our first steps as a collaborative around health equity.
Thanks, Beth. So yeah, one of the really exciting things in my own opinion, and I think a lot of yours, is the Wisconsin Cancer Plan 2020-2030 is the first cancer plan where equity is its own standalone chapter. And it's still woven throughout all of the remaining chapters, but we really felt strongly as a steering committee, as a staff, and the entire membership that equity really needed its own standalone area. And from our take and from our thoughts is that, similar to what Beth said, is that we need to make sure that our foundation is really built to support any equity efforts. And so we've actually been talking and consulting with a lot of various experts, Dr. Walker included, and previous current cancer collaborative members that are actually leading the YWCA in Southeast Wisconsin, Jenny Finn, a few other areas, just kind of spiraling. And we came to you, as Beth mentioned, last September, trying to think about, what this would look like. And I come to you today with a little bit of a better proposal that we want your maybe immediate responses to, and then are hoping to actually ask a few of you to help lead and guide. So back next slide. So there are 3 priorities within Chapter 1, Health Equity. And the first one is Priority 1, which is increasing the capacity to reduce the burden of cancer for everyone. And really, before we start any of this, we need to better understand our own work and our own representation. And so both in staff, in leadership, and in membership. And so in that, it's not just the representation, but it's also creating the climate and the welcomeness that needs to be present in order for stakeholders from all backgrounds and expertise to feel included, heard, safe, welcomed. And also, are we really spending enough resources in making sure that all of those voices and stakeholders are invited as well? So should we be doing more perhaps in, extending additional invitations when maybe we haven't heard something from, various stakeholders, and not really giving up, knowing that, there are maybe competing priorities, et cetera. Anyway, next slide, Beth. So I share this slide with some caution. It's a lot. It's our logic model. It's something that the staff knows intimately at this point. It's something that CDC knows intimately, or hopefully should at this point as well. It's really how our plan work on the left hand of your screen is intended to create our hoped results on the right hand side. The left circle is our staff the membership, which includes all of you wonderful leaders as a steering committee, our members. And we recognize that if we're not representative of our state and place emphasis on overrepresenting it and providing meaningful engagement from various communities across the state, in that circle, we're going to be missing the boat largely in the area that just then got highlighted. So we need to make sure that we take a really close look at how we operate, and the activities and staff and leaders create are reflections of our experience. So therefore we need representation reflective of that to make sure that our activities, such as convening our members, is it in an accessible place? Is, you know, I guess a silver lining of the pandemic has been arguably a Zoom, you know, or some type of hybrid opportunity, making this convening more accessible to folks that may be living in Hayward or don't have transportation to be able to allow them to travel to a central location like Stevens Point in the state. Our resources and languages that are you know, not just English. We are not just an English speaking state. We need to make sure that our resources are accessible to everyone. An example of this even is actually in a webinar that we held just a couple of weeks ago from the LGBTQ Cancer Network. We had this wonderful presenter, and we are actually testing out new Zoom services. And so what a typical feature that we have is being able to change our names. And so the speaker asked if we could change our names, and we didn't know that through changing our Zoom account that it disabled just one of that features. And so something that's so simple and would have been easy for us to do on the front end of making sure that those settings were set in the right way to allow people to change their name to reflect their pronouns is something so simple for us to do, but perhaps so impactful for something for one of our members to feel welcomed, engaged, and inclusive. And so is it important for us to maybe do an assessment to understand where our blind spots are and where opportunities are to present themselves, and then create systems or policies or standards of practice so we can make sure that we're creating a climate and a space that is then representative of our state and those in the highest need, and also then hopefully impact our intended results, which then, you know, if we don't impact our intended results, we could run the risk of further perpetuating inequities, and that is by no means our or any of your intentions, I am quite sure. Beth, I think next slide. So from there, we, you know, if doing an assessment, we'll have a really good baseline, right? We'll have an understanding of where we're at and then make improvements together. This isn't just something, a reflection of the staff, it's a reflection of the leaders, and it's a reflection of how we engage members and how members are able to be activated as a result of our leadership and provision of technical assistance, guidance, support, et cetera. And from there, then we think we could move the needle in other areas. So the other priorities of the cancer plan equity chapter, which includes priority 2, the issue of access to health care. And then the next slide. Priority 3, which I would argue, and I think it's easy probably for a lot of us to all see, is that if we don't really focus on priority 1 and making sure that we have all communities represented and feeling welcome, engaged, and safe to speak openly, we would not be able to meaningfully make any work in priority 3, which is all about centering priority health populations to, you know, collaborate and create together health solutions to various problems that are being encountered. So if you go to the next slide. So some preliminary questions that we've been exploring and tossing around are, you know, who's represented in the Wisconsin Cancer Collaborative and who's not? What barriers might exist to prevent necessary organizations from participating? Some of these questions I've already, you know, mentioned during this brief presentation. Our staff, steering committee, and members welcoming to new members. So we historically, especially for new steering committee members, we're a limited staff and we rely on steering committee members often to facilitate conversations, right? Are we giving steering committee members the right training and tools to make sure that they are providing a safe space, and pointing to the person who might not be speaking in the corner, but it's because the environment or climate or ground rules haven't been. So are we giving facilitator training to allow and make sure that steering committee members are well equipped to have equitable and facilitate equitable conversations? Is the collaborative able to retain members and make their engagement meaningful? And how can practices be established or improved based on the assessment findings? So I think, next slide, actually, we'll just go to it. Ultimately, it's an opportunity for us to really look in the mirror. Are we ultimately, as an organization, modeling the behavior in which we want our members to behave as well? Are we leading by example? I think the opportunity here then is if we do this self-reflection and this assessment as a group, we'll be able to, really show, and lead through a process and say, this is how it works for us. And if we don't do that, it feels, frankly, a little ignorant to come to other organizations saying, we see improvements that could be made. This is a process that could, be shared at a wider scale with our members. So next slide. I have a few questions for the steering committee, which I foreshadowed in the beginning, is that this initial gut check. I'd be interested in getting what your initial thoughts are. Do you all feel like this is the right step? I will say, I didn't say this at the beginning, this does not mean this is the only thing we'll be doing on equity. This, the action steps or action plans, will be focused on making sure that the populations in greatest need that are, by data or maybe even by not data, identifying data that could be missing, are we engaging the groups that need to be? And making sure that we're not further perpetuating, inequities in the action plans. But this would be a standalone, assessment for the equity chapter. And then the last two are just kind of next steps. Any organizations you think that would be able to conduct the assessment, or any communication channels that you would recommend that we could promote any type of RFP, realizing this is not work that we should be leading. This is something that external groups should be doing. We can't really recognize our biases or blind spots. We need someone else to be working on this with us. And then if you're interested in joining any type of small work group to advise us on this work, we would be grateful and willing to accept volunteers today or in follow-up email. So any questions, thoughts, volunteers?
Hey, Sarah, it's Beth. Just one thing that I know is continuing, and you mentioned it, but just to let people know again that I know this has come up previous, is that this would just be our collaborative. It would not be an assessment of our members or anybody else. This is truly us as an organization. So I know that question has popped up, and especially as we've talked about it internally, that I want to make sure people understand that this would be just our collaborative. And as you mentioned, Sarah, a great way to maybe say, hey, we're trying it, we're going to do this, and we're going to lead by example, hopefully, in something that might be successful for our organization.
So this is,
sorry, go ahead, Paula.
So I just would ask, so when you say, Beth, that this is just our collaborative, is it all of the members of the Wisconsin Cancer Collaborative?
Yeah, so I can try to, so it's not the member organizations, but it's the people who are participating. Okay. So I would say like expectations, or, maybe even, when you join, we typically have members sign, I forgot what it's called, but like, a form acknowledging, various disclosures, or I apologize for not remembering the language, but acknowledging them, like I abide by these rules to make sure that we're all on the same mindset and being and creating an inclusive environment. And yeah.
So I am in the midst of helping write a huge grant on this topic exactly, and changing institutional climate. And I think self-assessment will be very, very important. There's so much, right? And I think it can't just be a one-time self-assessment, but that hopefully the self-assessment will provide, sort of a shared measurement system or something to that effect, where we're able to see some where we are, where we want to go, right? And then how do we sort of measure that progress along the way? I think it could also help inform an agenda, so to speak, that will address some of our gaps and needs. And so I wasn't sure if that was the thought, that this would sort of be ongoing, not just a one-time assessment.
That's such a good question. And you're completely right. This cannot be a one and done deal. This needs to be a tool that's probably, done, maybe every 2 or 3 years. We would probably look to the group that's, overseeing it to help guide us on that. I will say within our own evaluation plan, we have a member analysis, and various, things that happen kind of behind the scenes to assess, our membership structure. And I think we could easily probably weave this into that as well. But not hide it, but I think it would be relatively easy once we've done it once to continue to do it and to make sure that the improvements that hopefully we set out to do based on that initial assessment are actually, working. This has been reminding me a lot of back in 2016, we took a pause on the then Wisconsin Cancer Council kind of committees, et cetera, to do what we call the revitalization and to really understand our structure, our member engagement, how we engaged members, et cetera. And we asked everyone to rejoin. And I think we've been successful, but I think in 2016 context, we didn't do as sufficient of a job as I think we would now when it comes to really thinking about diversity and inclusion. And looking back now, it's like almost like the revitalization part 2. And that revitalization, it's not something that you want to do on a routine basis. So I think regularly measuring and making sure that those things are maintained and enhanced over time is critical.
In terms of organizations, I'll just pop in that I know we work with an evaluator who has a lot of experience in this area, so she may have some ideas about organizations that do this.
I'm off mute now. Sarah, as you were presenting this, how large a group, and specifically the steering committee itself, as well as the staff of the collaborative, is that large enough to be included in an assessment to give you the information that you want about the collaborative itself, or just who would you include? I think someone asked the question already. Who would you include in this assessment, in doing this assessment?
I think we would look to like the contractor to help with that. But what I'm thinking is that the steering committee and the staff are, we're leading this work. And so we definitely need to take probably a couple steps deeper when it comes to an assessment, but we can't stop there. I think we really need to understand our membership and perhaps even people who are not our members and asking, why haven't you joined? And maybe they just hadn't even heard of us, or maybe something happened historically that, we're unaware of, or I think I would look to the contractor for that. And then obviously anyone willing to help from the steering committee guide this work, but it wouldn't stop with this group here.
Thank you.
Yeah, Sarah, I know we've talked about that, right? We've talked about the work is almost bigger than just cancer organizations. So we need to really look at who our members are, but maybe who's not a member. And as you kind of pointed out, the question we've been asking too is how do we engage new members? But then how do we keep them as active members and have this be a meaningful experience for them? So I think you had a great question, Dr. Walker. Is the steering committee and the staff may be very involved in the assessment and be a key piece to it, but I don't think they'll be the only ones included in the assessment because, I mean, right, Sarah, we need not only our members to see who our members are, but maybe who aren't our members and who are we missing and how do we thoughtfully include them? Sarah, Paula had to step away from a minute, but she just said she was supportive of it and wanted to share that.
So this is Carol Grabowski. I'm sorry to sound like such a dunce. And I'm having a hard time grasping what it is that what you're wanting me to help you with. So what's coming to my head is to enable to better have a group that matches the needs of the people. Who are we serving? Who are we serving? Are they Native American? Are they uninsured? Are they homeless? Who are we serving? Or is it other institutions?
No, it's such a great question. Thank you for asking that. We as a group and kind of by CDC, because we're primarily funded by CDC, we primarily serve organizations. And then those organizations serve those individuals that you just listed and mentioned. But as a statewide entity, we need to make sure that all of those individuals that you just mentioned are represented in the organizations that are members of the Cancer Collaborative to bring those perspectives. I will say I've been doing Cancer Collaborative work or cancer control work for a long time, and I always struggle with having it be the organization representing that community and the individuals is limiting to a certain degree, where we don't necessarily get the individuals with those lived experiences always. And I don't know how I struggle with that. I think it would be really interesting to have a conversation and probably not enough time to have that now. But I think it's also a lot to ask individuals, whether it be an individual cancer survivor, to come into this and to have kind of the ability to contribute in a way that makes them feel heard and comfortable, and it makes sense, right? But you could spin that and say, well, is that okay? Should we be taking the extra step to actually help that individual understand their role and the important voice that they have at the table? So that's why when I don't have the answers, I bring it to you if you haven't noticed. But I don't know if that answers your question. I'd be happy to talk a little bit more about that, but it's primarily organizations. We work with organizations that then hopefully kind of make change within their organizations that then impact their communities. So if we're not thinking about, I keep thinking about housing security, right? If someone is homeless, they're not going to be thinking about getting screened for cancer. So we don't have any housing organizations, members of the Wisconsin Cancer Collaborative. Something like that might come up in the assessment as a step forward.
Yeah. Sarah, this is Kurt. So when I look at the Wisconsin Cancer Collaborative membership organization, I mean, that's a pretty extensive list when I look at it. And maybe you've just answered this. When you look at that list, who do you think we're missing? And maybe I've just sort of restated your question. Where else do you cast a net to look for other organizations that would join that would have similar interests?
Yeah, I think I did. I guess the CDC, they don't have it figured out. I guess I can speak somewhat honestly, and I think that they would probably agree with me saying that, is that we know the social determinants of health, just for the reason I explained, are really important. They're the core root cause of a lot of the inequities on top of systemic racism. And so it's really hard to think about, why would a cancer organization involve the housing unit, or perhaps a workforce development group at a community level? Well, it's because if we don't solve those issues, people will continue to get not screened for cancer, or go without treatment, or not follow their treatment regimens. And so I would say selfishly starting there would be really helpful, because I do know that CDC is hoping to have that figured out soon, and would likely call upon states to follow whatever model that they've set forth. And if we're ready to do that with our organization or our coalition composition, we'd be in a better position. And again, that comes from like a self-serving vantage point, and which is improve outcomes in Wisconsin and our attended results, I believe.
Okay. So not having the list in front of me right now, organizations that do a lot of, social support for families and housing, things like Salvation Army, YMCA for, after school care and better health and exercise, initiatives like that. Are those organizations part of the Wisconsin Cancer Collaborative?
Not really, no. I mean, we're really great with local health departments. We have a lot of health systems, nonprofits, but most of them are not what I would consider fulfilling the basic needs of individuals.
Yeah, because I think when you point out the social determinants of health, those are the organizations that provide the infrastructure, sort of to start off your Maslow's basic requirements before you can even think about healthcare.
Exactly.
Well, I've looked at the list multiple times, and I've tried to identify any organization that focuses, say, on veterans' health, as an example. And they're all, kinds of individuals who fall into that group. And VA centers are all around the country. There are different levels of economics of individuals who are veterans, but yet still, I don't see the VA in any way as represented on the council, so to speak, in the collaborative. In a lot of your questions, your comments, like as in terms of who's missing. I mean, what do we think about the VA and its contribution to the whole healthcare system?
You bring up that's a big, giant missing group of people being served that's not represented at the table. I think there have been maybe historical representation, but at this moment in time, it doesn't exist. And then I think, these are all really great questions that we would love more guidance on. And so if anyone is willing to, sit on a phone call with myself and maybe a couple other staff members to pick your brain, kind of develop some type of request for proposal, and then come up with some organizations or organizations that might know organizations, because I realize we're only, again, limited to the people we know ourselves. So getting the word out there, we've already done some research ourselves to find various organizations that we think would be likely to put together some type of proposal for us. But again, this is work that we can provide insight on what we want to accomplish with the help of the steering committee, but not work that we can lead ourselves, knowing that we are inherently biased.
Sarah, I mentioned in the chat, and I'll say it here, if anybody is interested, please put your name in the chat and let us know. Or if you have any potential organizations to work with, we'll grab all of that from the chat and follow up. So Thank you, Sarah. We'll continue. This is just the beginning. So just know that this is awesome because this is just the beginning first conversation. So know that this will be something we'll be engaged with for the next probably 2 years at least, just as we wrap up the assessment. So if you're interested in getting into the details and want to give us some more feedback, we'd love to have you join that conversation. Or if you can't be a part of it and you just have more thoughts, reach out to Sarah and I. We love to hear it. So Melinda, if you're still on, actually, I'll keep going. I don't know if we still have.
It's you just continuing on with the
Keep
action.
going. Okay.
Perfect.
So what I wanted to do is just take us into a discussion as we've now talked about the assessment and maybe some possible opportunities that we have to work on health equity, kind of as a cancer collaborative and how we can guide the work of our members. We wanted to get some thoughts from you on when we talk about action plans and we talk about steps that the membership could take and the Cancer Collaborative could help guide or help support. We really wanted your thoughts. So I'm going to walk through each of the 4 action areas that we've identified through our work previously in September and October, and really get your thoughts on what could be some action steps or some areas that we may want to suggest as part of our action plan to move forward. So, for example, when we talk about objective 1, so when we look at increased recommended cancer screenings through the reduction of structural barriers, I'll give you an example of a couple of, these are action steps right from our cancer plan. So if you look at our plan and under this kind of objective, this is what you're going to see. But these are kind of big and broad. Do you identify any individual steps we can take? And I'm going to provide a couple just to give examples, but know that there's probably, you'll come up with better ones than these. But what would be some action steps under this type of objective that we could put for our membership and be supportive of those efforts? So optional activities could be, we could develop a statewide community of practice or a learning collaborative that would bring together clinics and kind of assist them on how are they getting back to screening or how are they increasing screening rates through this pandemic. Clinics doing, clinic reminders and recall systems, and how are we catching people up in screenings, the utilization of CHWs, or, exploring opportunities to navigate people with access to health insurance, since we know that some people have lost it through this, pandemic. So I just want to put that out there. I would love your thoughts and comments and discussion. So if there's anything to start with. Do people like these ideas? Do we just nail it? This is great. This is what we should be doing. Anybody in that space?
I'm just trying to think about like my own personal experience, having just crossed a particular threshold that now makes me eligible for several cancer screenings. And I didn't get any reminders from my health system. And I was shocked. It's a good health system. I don't know why I didn't get a reminder. Is it maybe because they were giving me the whole year?
Part of it, I think, is they rely heavily on MyChart. I think they rely on you to access your record, and all those reminders are there. They flash up, but you're right. There's no little card or.
But I get a postcard telling me it's time for my kids to come in for their checkup.
Yeah.
And
so I can speak to that just a little bit, knowing where cancer screenings are in large healthcare organizations. Over the past 9 months, we've seen just the access to routine cancer screenings drop precipitously. And especially for things like colon cancer screening, there was a period of time between like March and June where the GI docs were just like flat out like, nope, no cancer screenings whatsoever. We're only going to screen the situations where we need to do intervention, where there's clearly problems. Now they're starting to go back and look at just the backlog of all the people that they've just missed, let alone going into the prospective people of which, say, you are in like getting started being the asymptomatic. And we're seeing this huge bolus of people who are going to come into the system. Unfortunately, some of those are late, and as many of you also know, the NCI put out a paper not that long ago looking at the number of cases and excess deaths across our country to be more than 10,000, just looking at this like 4 to 6 month lag of screening, which is, just shows how valuable screening is and how much work we
This
have
is
yet
his
to
wife,
do.
Paula.
I was gonna say that I know for people who don't regularly go into a clinic or a hospital, anyone who works there now is not necessarily thinking that this is the case, but it can feel like a really scary place to go during a pandemic. Like, oh, I'm gonna stay away from the hospital. So how do we either they can get those screenings safely or bring it to them in places that they're already comfortable?
Even just a statement that you can come back to the hospital now, which I don't even know that we can say that yet.
I think that's one thing that's made things like Cologuard so popular right now is it's a home screening test.
Yeah, that's a great point. That you're right. People still are probably a little nervous because there are still messages as you shouldn't go out if you don't need to, right? There are still communities that are very actively saying, stay at home if you can. So, does that mean I should go get my cancer screening? So that's a really good point, is not only are the healthcare systems trying to make sure that they can handle and have the access, but also we're seeing maybe some messages. So that's a really good point, something we could be helpful in supporting.
So Beth, you, in your statement, the objective one, I see the point of you make about structural barriers. I mean, what in some of the earlier discussions, structural barriers may very well be an issue for certain populations. Everyone does not want to go to a hospital to get screened. I mean, that in itself can be a barrier. So are there opportunities, i.e. facilities, places, spaces, whatever the one can go to get properly screened, no matter what the screening is? I think that in itself, I think you're correct in looking at that issue.
So looking at just meeting the needs of what are the structural barriers in the way of people just accessing screening, if they don't have access to the healthcare system, where else can they go?
Yeah, as was mentioned earlier, but someone who, say, lives in a housing project or whatever, whatever their status is, especially if it's a a low SE economics individual, that they may not have the resources or the means in which to get to a facility unless it is within their area, their local area. And how many of those exist, free clinics or whatever.
And I think Dr. Dr. Walker makes a great point. I think that the idea that we don't really know what all the barriers are. For some people, it might be transportation. For some people, it might be they are just intimidated by the health system. For some people, I think about the access of mobile screening units and how we can reach populations that don't live close to a facility. And so I think it's all of those things that need to be looked at, and maybe the barriers needs to be defined a little bit more so that we can identify what it is that we have to find a workaround.
This is Carol. One of the options that comes up all the time and is almost immediately shut down for overtime reasons is extended hours. So many people between 8 and 4 that will never work for them as they're trying to hold on to health insurance. And
I will say, even as somebody of relative great privilege, right? 8 to 4 right now, my child is with me all the time. Like, there are some cancer screenings that I would prefer to do alone.
So this is Gail again. I love the discussion about the 8 to 4 because what we have been trying to do with the Well Woman program is a small experiment where we're trying to see if we can get a few providers to do evening and Saturday clinics. And I will tell you now, we don't have a lot of sites because, you know, this takes quite a bit of, shall we say, work. But we've been able to work with the city of Milwaukee. We've also been able to work with Marshfield Clinic. We know that the Saturday clinics in Milwaukee have been very popular. They don't take place every week. One of the selling points, I think, is, okay, we're not asking you to do this every week. Even if you look at doing it once a month or once a quarter or every other month, it can make a difference. We've had some evening clinics, screening clinics that have worked out okay, but it seems like from the information that we have up to this point says that the Saturday clinics have been quite successful. So I just wanted to share that with everyone.
Great. Thank you, Gail. That's really helpful because one of the things we talked about is, you know, do we want to create this community of practice or learning collaborative? And maybe that's what we're hearing is there's maybe some best practices out there, or there are some opportunities for others to learn what's going well. So do we feel good that this is something we should build out a little more, and we should look around these structural barriers and provide some thoughts and really encourage how members could take action on reducing these structural barriers? All right, we will continue to build out on this one. Okay, next one we wanted to talk through was objective 2. So this is really going to be those efforts that are going to support those risk reduction by individuals. So that's decreasing alcohol consumption, increasing access to healthy foods and physical activity. So when we look at the cancer plan and the action steps that are listed, you know, here are some that just rise to top of mind. So as we talk about pandemic recovery, you know, one of the things we've talked about is the messages we might have provided a year ago may look very different, because we know that where people are today is different. So if you would say a year ago, like, just get out there and exercise, go to the gym, or, you know, meet up with friends, it's different, right? We're not there anymore. And it's a different space people are at, because I also feel like, you know, stress and our mental health might also be a piece to it. So, you know, some of us are just trying to hold it together, right? So don't tell me to exercise. I'm just trying to, right? And I feel like we might have people that I'm speaking for myself, but I maybe totally am. But, you know, the one more thing might be really hard. So how do we partner, or how do we support people really doing this? Because it's important, because we don't want to lose the momentum we had in these risk reduction behaviors. So I'd love some thoughts when we talk about, you know, are there maybe, again, ideas and initiatives that are out there that we should be supporting, or we should be telling our members about? Should we be improving access or utilization of programs? Can, you know, we help our members do that? And should we still be, which I feel like, you know, this is a great opportunity, is to increase that awareness between alcohol consumption and cancer risk? Because we know that's something we had started, and should we continue to do that, but, you know, in maybe new ways, or even, you know, increase that effort? So would love some thoughts.
So this is Paula again, and my thought is that we need to pay attention to health literacy and how we message things, and we also need to be very specific. So if you're telling me to get outside and be physically active, you need to tell me what that means, or I'll think that you want me to run 3 miles the first time that I get out there, and I might have a heart attack. I mean, so I think it's important to be very specific and then think about health literacy. And I don't know if, you know, the staff have messages like this out there, or if there are resources to share those kinds of explicit messages. And then I also think about making sure that it is something that resonates with the diverse populations, because it might be very common for some folks to go on a family walk or a hike. And other populations, that might not be something that is common in their, in their neighborhood or in their, where they live or in their community. There might not be accessible places. But I think telling people specifically what we want them to do is important. And I think the same thing with alcohol. I think we need to say what we need to spell it out very clearly, because we live in a state where there's not a good relationship with alcohol, and we want to help people to reset their relationship with alcohol, because it's not like tobacco. I don't think that it's quite like tobacco in that, tobacco increases your cancer risk any amount. Whereas is alcohol like that or not? I don't know that it is or it isn't. I'm thinking that it isn't quite the same. And so we need to be very explicit.
Thanks, Paula.
This is Carol. I have two things that have come up recently. I think most people in the healthcare system get these emails that you're not quite sure how they ever made it through the firewall, but it did. And the title was 3 things every healthcare provider must do to survive getting through 2021 with COVID. And the first one was to get outside. And the recommendation was that you get outside every day for 10 minutes. And I literally thought, who can't do that, right? I mean, a defined instruction that isn't going to take a lot of, there's almost no excuse for not doing it. The second one was yoga. And the third was journaling. And then with alcohol, it's almost before you can sort of impress upon people its connection to cancer. I think people are unaware. I'm sure there are people that didn't drink during the week ever at all that drink every day now. Probably haven't thought about it a lot, probably aren't even aware of it or know to be aware of it. Probably don't want to admit it.
Yeah, we've had that discussion that, as you're we talked about it a little bit when you're talking with youth. You talk to youth and you say, well, don't smoke because you're going to get cancer and, your lungs are going to suffer. But kind of when it came to the discussion about alcohol, sometimes parents just say, well, just don't do it, right? They don't necessarily tie the health consequence to it. So it's kind of this interesting area we're entering into and trying to really define alcohol use and its connection to a health impact.
Yeah, this is Sandy. With the alcohol piece, I actually worked with drug-free communities and incorporated some of the information from the correlation between alcohol and cancer. So working at the local level doing that. But I agree with Paula when it comes to alcohol, it's that consumption and even a learning curve with just consumption. So I think there's a long way to go with the education about the connection between alcohol and cancer. But I like the 3 points that someone just made about, get outside for 10 minutes, something really simple that people can relate to and people could easily do.
So do we feel good? So we feel good about keeping this as an action area. And maybe what we'll do is we'll kind of look to these action steps, but again, look for some of those examples. I think Dr. Grabowski shared a great one of, if we could just give some very specific things that don't make it so difficult. Don't just go exercise, take 10 minutes to get outside, right? Here's an example of a yoga, class you could take. It makes it very easy for people then to not make it seem so big. So I love that idea. So if people are comfortable, we'll take some of these ideas and come back and really, the other thing we'll do is we'll make some connections. We also want to know that there are partners out here that are working in this space more than we are in how do we increase physical activity and, healthy eating and, lower alcohol consumption. So if we feel good, we'll keep working on this one.
So I have one other thought, Beth, and that is that, as we have so many organizations that are Cancer Collaborative members and making sure that we drive people to the Cancer Collaborative's website, that you have things ready to go that people can copy and then include in their newsletter articles or their newsletters or whatever it is, because then I think you'll get traction with the same message across multiple populations. And there's also then that recognition if they'll include that this came from the Wisconsin Cancer Collaborative.
Great, thank you, Paula. And thank you for the feedback that's helpful to just have those, small information bites that you can take and put other places. So we'll make sure that's a part of the action planning steps.
Yeah, and just a quick plug that after several conversations with the state substance abuse program, I think there's going to be some integrated cancer and alcohol education that's going to be provided to a substance abuse coalitions across the state. So stay tuned as part of their small talks conversation. So stay tuned. I know we're running out of time, but I just want to let you know that there's some exciting things that we'll be able to share soon.
Thanks, Sarah. And thanks for the active chat. So Kim and Annika and Noel, thank you for the feedback you're providing in the chat too. I'm trying to catch both of them, so I appreciate the comments in there too. The third one is really looking at opportunities to improve patient outcomes and support healthcare professionals. So really, as we look at this pandemic recovery and where we're at, we looked through a couple of steps, creating and providing resources and information for patients, establish a plan to provide equitable access to cancer treatment. So these are from the plan, but we also know now we had a pandemic, right? And that really impacted our patient care. So one of the things we wanted to put out there as possible activities that could be included is there going to be some steps needed above and beyond these action steps in encouraging COVID vaccinations for survivors? Should we be creating and distributing an FAQ around vaccines and cancer and COVID and that connection? Would that be helpful? We also have thought about, do we need to explore emergency preparedness as it relates to cancer control and treatment in the pandemic? So not only how are we recovering now, but do we need to be reflective in what happened and how treatment changed? And so we're prepared moving forward. And a big piece is mental health, not only of our patients and our caregivers, the stress that they went through in having their routines changed or a caregiver not being able to be in the room, but really big, the healthcare professionals that not only had so much stress to endure as providing care during this pandemic, but many times had to step in and be that caregiver when a patient's caregiver couldn't be in the room. So just some thoughts to share and would love your feedback.
I can tell you now, this is Carol Grabowski again. The patients are frustrated that they're not in the tiers, the announced tiers of people who will be getting injections, which they're unhappy since they are immune compromised, and I'm kind of unhappy too. And yet, if it were up to me, everyone would all get vaccinated everywhere simultaneously. It's just not how it works. But a lot of them are questioning whether they should, if they can have it, or if they should have it. And maybe one of the first things to either dispel is, yes, everyone should be getting it, or everyone except for, I don't know who, X, Y, and Z should be getting into somebody's queue or list of people for vaccination.
I'd agree with you, Carol. I also think that, so that communication, does it come from the Cancer Collaborative? Does it come from the health systems? I mean, I know the health systems are under so much stress with trying to deliver vaccinations, and the supply is a huge barrier and burden to figure all of that out.
But I don't know if it should come from the CDC. I literally, who can make the far-reaching statement that would be the truth?
Well, there's something called SDMAC, which is a state, I actually don't know what it stands for, but it is a statewide organization that makes recommendations in a public health emergency. The SDMAC is what the abbreviation of it is. That might be a place to ask. And so connecting with the Department of Health Services and their vaccine delivery work group might be a good place to go. Because like cancer, there are other chronic diseases that folks have that, does diabetes put someone more at risk for an ill effect of COVID than heart disease, than cancer, than obesity, than, anything else? I think the science isn't maybe not known yet, but it surely isn't clear to those of us who are caregivers of someone who is recovering or of someone who's going through treatment. And so I think that clear advice from someone who, you can trust would be really important.
Yeah, this is Sandy too. I've worked at 3 of the COVID clinics. I mean, the first time when we knew we were going to get some vaccine for the Fond du Lac County Health Department, 3,000 calls crashed our phone system. And we still have a waiting list. So it's also, there are a lot of frustrated people, but it's also like, how much vaccine are we going to get and when are we going to get it? So I do agree. I mean, there should be some, it's confusing across the board for so many individuals going to their individual, healthcare provider, and then some of our clinics. Ours have gone very smoothly, but we still have a callback list.
So what I'm kind of hearing is maybe we're on track here. These sound like they're very relevant issues to where we're currently at, but maybe a very timely thing would be looking at this vaccination recommendation for patients and getting some clear information out there. I know Dr. LeConte was posting in the chat a couple of organizations that are lead cancer treatment organizations. Both the NCCN and the AARC have both come out with statements supporting cancer survivors getting vaccinations. So maybe that's something that we as the collaborative can look at, putting together some of that information and getting it out fairly quickly. It sounds like maybe that's very timely. But then we'll also kind of look long-term on some of these other health impacts. So I know we're running late on time, and I want to make sure I'm very respectful of everybody and their time today. So the last one that I really just wanted to talk through, which we did quite a bit today, not only in the other objectives, but with Sarah's presentation, is really looking at those, our health equity, our social determinants of health, and knowing that this will continue to be top of mind. And what I really appreciated is, as we talked through the other 3 objectives, we really had this as a more of a guiding thought throughout those objective conversations, that it's not going to be, it's standalone, but it's really how is our social determinants of health going to impact our overall cancer control efforts. So we will continue to have this as kind of if there's some additional thoughts or anything people wanted to share on this one, I'll open it up. Okay, maybe we said it all already. People are like, we're good. We'll keep talking. So the next steps on the action area planning is really going to be, as a team, as a staff team, we'll take this back. We're going to clean it up a little bit. We may pull you in for some additional thoughts. So just know if you get an email or a phone call, we may just want to keep pulling you in and getting your thoughts throughout this process. And we'll come back to it our next steering committee meeting and having this really cleaned up. And is it, how can we make this doable, workable, and usable for our membership? So I really appreciate your thoughts. As Sarah said, we value all of your leadership and all of your ideas because we just kind of look forward to this time to share with you and say, are we on the right track? What more can we do? And helping us give those thoughts. So with that, I have another question for everybody, but we're going to move into our thoughts around the Wisconsin Cancer Summit. So every year, for those that are kind of new to our team, is we provide an annual cancer summit. Traditionally, it's always been in person, and last year we went virtual. So what we wanted to do is, we're not sure if we'll be virtual in person or a mix of both, or where we'll be, but what we really do want to know is, what should our theme be? What should our topic of conversation? This will be towards the end of October in 2021, just so you have a time frame of when we would meet for this meeting. It's open to absolutely everybody. So hopefully most of you have participated before, but we really open it up to anybody who's interested in cancer control in the state. But what we were talking about this year is, what would our steering committee members think about if we looked at this theme of a bridge between the social determinants of health and the impact on cancer control? So as we've mentioned a couple of things today about barriers to care, of housing and how that impacts a person's individual health, would it be of interest, and could we have some pretty interesting discussions if we talked about social determinants of health and that bridge to cancer control? So access to care, housing, food insecurity, are there some issues? So what do people think of this theme? And if it seems like, yeah, maybe this is really it, are we listening to what we need, the discussion we need to be having in 2021? So please let me know if this is a yes, or maybe like, you missed the mark. Here's a much more important piece. So we want your feedback.
I don't know if Gail is still on the line, but I'm going to say things that she said to me in the past, which is that it's really difficult for someone to think about, and it was brought up earlier by someone else too today, but it's really difficult for someone to think about cancer screening when they don't have a roof over their heads or they don't have food on the table. So, you know, I think it's really challenging as a cancer collaborative for us to think about the things that, right, that are our priorities when, you know, the Maslow's hierarchy aren't even met for some significant portion of our population. So I'm struggling a little bit because I'm afraid that we could wind up diverging so far from what is our space, but that's my opinion.
Yeah, thank you, Regina. That's kind of the feedback we wanted. We wanted to know, and that's where we really, you know, where is our role as a cancer collaborative? And would it be helpful for us to identify and help bridge that connection to cancer control? And just as you said, if somebody, I would say the same as, you know, not only screening, but cancer treatment. If you are worried about where you live and you're worried about where your next meal is coming from, not only just getting that cancer screening, but through a diagnosis, you know, how is that impacting you in getting your care you need? Because cancer treatment might be last on your list of priorities because your kids and your housing and your food and your job become such high priorities. So, you know, is this the year that maybe we want to just start to address some of those? And not that we would solve them, but maybe it's just for us as a cancer collaborative to be those conveners and bring these topics forward for our membership and other, you know, organizations in the state to talk through.
I don't know, this seems like a big bite. What did you do last year?
So last year we revealed our 2020-2030 cancer plan. So we kind of walked through the different areas of the plan, and we had a couple of specific discussions around, we had a specific discussion around health equity as a new chapter. Okay, so maybe we need to keep thinking about this. I feel like so here's what I'm gonna give homework. So if people could think about this and let me know, and maybe email me if there's a theme that strikes them more. And we can do this via email, so we don't have to sit here, and we just brought it today. So think through it. But the other piece that might be top of mind is if you know a dynamic keynote speaker, if you can think of somebody that would be great for our collaborative to bring in and speak. We are able to do that. We're able to bring in speakers. So if there's a dynamic keynote speaker that you might suggest or feel would be important for us to maybe have present to our group this year, maybe I'll give some homework and we can think about it because this is a pretty big one. And as I said, our team has been thinking about it for a little while. So to give you all some time to react and provide some feedback later on. Does that work?
Sounds good.
All right. I just wanted to give a minute or any time, if you would like to share any member updates, use the chat or just come off mute and let us know if you have anything coming up that you would like to share or would like the rest of the steering committee members to know. One thing we like to do too is each month as we do our Engage newsletter and on our website is we love to share member events. So if you are having a webinar, if you are having some sort of event that you would love the public to know about, we love to know those things. We like to share them as member spotlights. We like to make sure we're promoting them on our website. So not just right now, but anytime, please let us know. Thank you, Kim. I see you have to jump off. We have a couple of people jumping off. So I know the time is short. So I would just say, please let me know any of those activities that you'd like us to know about and share. We are happy to do that. Next up, I just wanted to share the rest of our meetings. So we will meet in June and September and December. It'll be from this 1 to 3 timeframe. Right now, I have them all scheduled as virtual. And as we, get going through the year, we'll see if there's any opportunity for us to come together in person, because especially with some new members, I know we would all love to just see each other. And, for some of you, give hugs. I know hugs was a top priority for some members. And also just remember our monthly webinars. So I'm going to again send out the reminders to our steering committee to, if you want to put them on your calendar, you can. If you're not able to attend, no worries. But just like me, I love to have a calendar reminder because it just prompts me to think that there is something I could be attending. So if you're able to add those to your calendar, I'll send out those invites. So I know Dr. Stolle had to jump off. So any last minute thoughts for the group or the team? Well, thank you for joining. Amy and Sarah, thank you for presenting. I appreciate it. Welcome to our new members, and reach out if you need anything. Thank you, everyone.
Thank you.
Thank you.